professor of saxophone at Stephen F. Austin State University.
I'm Kim Luevano, professor of clarinet at the University of North Texas. And I've noticed when I have students come for a first lesson, inevitably it's about air use and how to use the air more effectively.
Absolutely.
Learning how, despite breathing is something we do as humans on Earth every day, the way we use our air to play our instruments successfully is very much different than our normal use of air.
Getting them to focus on relaxing.
Yep.
Getting them to, just make sure developing an awareness that there's no tension here, that there's no tension in the chest or even, in the back or abdominal walls is an important first step.
Absolutely, because any tension that's there is going to prevent them from expanding and opening and getting as much air in as they could otherwise intake.
Yeah. For us, focusing on the low breath really gets them in a spot that's going to help with support, also help with lung capacity, increasing the volume of air that you take in.
Right. I've heard diaphragmatic breath, but I found for students, really, if we just talk about expansion, and it's usually lower than they think.
Yeah.
So I usually have them put a thumb on their belly button, right? And then the place where your hand is underneath your belly button is actually the place that can expand, right?
Great.
And then if you imagine that expansion going all the way into the back, right? And allow the ribs to open up and expand, and allow each of the vertebrae to have space between it, even allowing the sternum to float, that seems to help.
Now, what about here? How do you focus on the windpipe?
Yeah, well, that should also be relaxed. And as a clarinetist, I have a built-in tool, the clarinet bell. And if you're not a clarinetist, you could use a paper towel roll or a wrapping paper tube. But basically, the diameter of this is big enough that it sort of forces us to open our mouth wide enough. And so the point is that you would open your mouth wide enough to have your teeth on either side of the bell.
Yeah.
And it sort of, if you take enough space in your mouth, then it's pretty impossible to collect any tension here, right?
Low sounds, open sounds.
Low sounds, open sounds, peaceful sounds, anything high-pitched or raspy is undesirable.
Right. Yeah. I use a slightly different technique. You mind laying down on the table?
No?
So one of the things I like to do with my students is I like to take a book and place it on their stomach. And what we're looking for here is expansion. So we're going to be thinking about raising the book up to the ceiling, getting the book up high. So can you try that? Perfect, perfect. Okay, let go. All right, try it again. Excellent. So you see how much higher this has gone. You're really engaging the abdominal walls. Can you feel that?
Very much.
Perfect. Okay, great. This is a really nice way to focus on this expansion, and then from there we can go on to exhalation.